Hey, it's Jeff with Mart. I'm a product expert here, and I've been a registered nurse for over 25 years. This is a little update on some things to think about with the Med-Mizer ActiveCare Bed. So we're going to talk about the height on the bed for a little bit, and that's a very important thing to think about. So right now, I have this bed at 12.5 inches from the corner of the deck down to the floor. This would be the fixed height position if you said, you know what, I'm trying to get into this bed, but I just don't want to spend the extra money to get the adjustable height. This would be my setting without any casters. So keep in mind that I won't be able to roll the bed around, but this is where the bed would come in at if I were at 12.5 inches with no casters. So I am 5'10". So for me, obviously, this would be a little low. Could I get up from a bed like this if I had no mobility? Probably, especially with the assistance of the pivot and the pivot bar. But this is about what this would be like if I was going for the base model. So now I have the frame 15.5 inches from the ground to the floor. So we're right about here is the top of my frame. It puts the mattress height at about 22 inches. This is probably going to be the most average for most people's height. So even myself, I'm able to sit down. Now my legs are bent, my feet are comfortably on the floor. So especially if I'm using the stand assist bar, it helps me to grab onto that and pull myself forward and stand up. So this is a very comfortable height for me, again, at 5'10". So the next option is to go with 5-inch casters, which basically does exactly that. It will raise it up a little bit more. And the way the casters go on there will raise me up then to 18.5 inches. So let's take a look at what that looks like. This is 18.5 inches. This is with the 5-inch casters, and again, at a fixed height. So you can see right now, it's hitting me about the back of the leg. When I sit down, I have a little bit of difficulty getting my feet 100% flat on the floor, especially if I sit back in the bed. So for myself, it's probably be a little bit on the tall side. So I would probably say for myself, 15.5 inches is a good height. So the fourth option on here is probably the most popular and the most versatile. It's for depending on which all your health needs are now or maybe in the future. And that's the adjustable height, where we'll go 12.5 inches that you saw a minute ago all the way down the ground, all the way up to 27.5 inches. Now, unfortunately, the reason it does make it more expensive is because Med-Mizer needs to put two heavy-duty motors, one at the foot and one at the head, in order to make it adjustable the way that it is. So obviously, the less expensive option is to keep it locked in place at a fixed height. But there's a lot of advantages to having the adjustable height. One is I can make the bed exactly the right height I need to make it easy to get in and out of this bed. Second is, let's say later on at some point I become a little bit of fall risk. I'm concerned about maybe rolling out of bed at night. I can drop this all the way down to the ground and make it easier to be closer to the ground. Also, the main thing, and you see some of the videos I do on the other one and on this video, when I go to sit up and go to stand up and move forward, it almost becomes like a lift chair. I can actually use the up button in the bed at the same time while I'm stepping up and stepping forward, which makes it very easy then to get my feet right underneath me and step forward easily. Also, if you're just sitting up, watching TV, things like that, and you want to make sure your feet are flat on the ground, you're able to get the exact height you need. So let's go and take a look at how high 27 is. And another benefit as well is, let's say if I'm relying on some caregivers to help me a little bit, maybe turn, occasionally I need some assistance in bed. So by raising this to a 27.5 inch height, it makes it much easier for someone who's helping me to not have to hurt their back by helping me turn. Maybe they need some help getting dressed, things like that. So it also makes it easier for the caregiver as well. One of the new features that's available that was recently added to Med-Mizer Bed is the ability to get what's called Trendelenburg or reverse Trendelenburg options. And that's really just a fancy word for either head down or feet down. And it basically then allows you to push that button, tilt the whole bed with the foot down, or bring the head back this way and elevate your head. So that way you can actually take advantage of the foot part of this. If you need to raise your legs up for swallowing, things like that, and your doctor says you need to elevate your feet, I can tilt the head up a little bit, bring the feet up at the same time, and kind of cradle myself in a nice neutral position. It's also kind of nice by using the Trendelenburg is I can sit up, but then tilt the bed backwards and kind of get a zero gravity kind of feeling. So I can take some of the strain off my hips and my knees and things like that. So it just adds more versatility to this bed. When you are shopping through and trying to select this for checkout, you notice it's 3 different mattress options, basically going from medium support all the way up to air mattress type of tubes that run through it. If you have any questions about what's a good mattress option for you, give one of our customer service reps a call. They'll be happy to help step you through that. If we have questions or something we can't answer, we're happy to get a hold of Med-Mizer and get the answer for you. When ordering the ActiveCare Bed, a couple more things to think about is make sure that you know if you're going to be pivoting right or pivoting left inside your home or facility that you're at. The reason is because it has to have the pump, the motor itself that actually is part of the activating process, set up on either side. It can be changed later with a little bit of work. You may have to have a maintenance person give instructions on how to change that out. But ideally, we like to get it set up from the factory. That way, when it comes to you, it's already ready to go. The other thing I want to kind of go over again with you guys If anybody is looking at the ActiveCare bed, there's two options for rails. These are called the quarter rails. They basically attach in the upper section. Makes it easy and convenient to hold on to this, pivot yourself around the bed, turn yourself on your side. Just an extra way to hold on and it makes it easier to kind of navigate around the bed. There is also something called the stand assist bar, and that's what this looks like. So there's one that's designed to go on the right, one that goes on the left. And this basically helps you stand up out of the bed if you need that extra little bit of support. So basically this attaches right here on this midpoint in the frame. There's one little small section, attaches very easily with 4 bolts. So basically this hooks onto here, securely attaches to the frame, but this basically keeps it right here, easy to hold on to when you go to get out of bed. If you want to kind of get it out of the way, you can take the whole bar itself and pivot it out like that, and that way if it happens to get away from your legs, or you're going to be in bed for a long time, you don't need it, then when you do pivot the bed, this will come this way, you just pull this around and it locks into place just like that.